There is no doubt that BSoT's virtual meeting in 2020 was a real success, and I'm really looking forward to seeing how the platform for virtual meetings has evolved since then.
Really looking forward to virtual BSoT this year. FNUU has got 4 superb sessions.
The programme for BSoT 2021 is brimming full of exciting sessions, and the one I'm perhaps looking forward to the most is the one by the section of trainees on excellence in core procedures. These are operations we tend to learn early on in our training and form them bread and butter of our practice as a urologist. However, during our training, the focus tends to be more towards subspecialty practice as we go on.
There's several things I'm looking forward to, especially from the functional urology side: life after radical prostatectomy, overactive bladder, benign prostatic enlargement, minimally invasive treatment options, recurrent UTIs, and the use of mesh in men. In addition, there's several other sections, some novel, such as a brand new section for medical students. I'm particularly looking forward to the BSoT audit section, the burst section, and the section on consent, and in particular Tim O'Brien, the President's conversation with Nadeem on
During an era when we have lost theatre time, it presents an excellent opportunity to learn new tips and tricks going forward.
I'm excited for the sessions that BSoT put together as part of the BSoT 2021 virtual annual meeting. In particular, personally I'm interested in the session on what is expected of a day one consultant, as well as the course Thriving as a Consultant, as I start to make the transition out of training. I think this just goes to show how BSoT are continuing to support trainees in this uncertain time as they transition out of training and into consultant practice.
I think what I'm most looking forward to are the updates from some of the big trials and discussions of the ongoing trials. Lots of things have been published this year. Monday morning, we've got our recurrent urinary tract infection session. We've got Alter reporting, discussion about Alter, and we've got some really interesting guests from the University of Dallas. That's Professor Zimmern and Dr. Nicole Danisco. Tuesday afternoon, we've got our overactive bladder session. We'll have updates from the Rosetta trial. We've got Cynthia Munson from North Carolina, Professor Hisaker from the Netherlands. Then on Wednesday afternoon, we are joining the andrologists for an exciting session on mesh in men. The master trial will be presented, discussed. As you all know, it's been published this year, and there'll be a debate on mesh in men.
There's no doubt that I'll miss catching up with old colleagues over a coffee in the exhibition hall, but I think one of the real strengths of the last year's meeting was the ability to catch up on sessions which I've missed out on when it clashed.
In terms of the benefits of the virtual format for the meeting, in particular, I think the ability for trainees to easily take notes throughout, as well as pause and rewind presentations, will facilitate learning for those studying for the exams. And personally, I really struggle with fear of missing out during the face-to-face session, when faced with deciding between 2 very interesting sounding sessions, and the benefit of being able to go back and watch these for up to a year will certainly alleviate that.